Just going to wait a few seconds for everyone to join. Okay, good evening, everyone. Welcome to our webinar on MonaLisa Touch treatment for vaginal dryness. My name is Vicky and I'm hosting this session. I'm joined by our presenter, consultant gynaecologist, Mr Rowan Connell. The presentation will be followed by a question and answer session. So if you'd like to ask Rowan a question during or after the presentation, please do so by using the Q&A icon, which is at the bottom of your screen. This can be done with or without giving your name. And please note that this session is being recorded if you do want to provide your name. If you'd like to book a consultation with us, we'll provide contact details at the end of the session. I'll now hand over to Mr Rowan Connell and you'll hear from me again shortly.
Thank you, Vicky, and welcome to everybody. And I'm delighted that I've been asked to give another talk on MonaLisa, and more women than ever are now on this webinar, which is great, and also more health professionals than ever. And hopefully that means that the information about MonaLisa Touch is getting out there, but also that we're talking about vaginal atrophy and the MonaLisa itself. From my point of view, I'm a general gynaecologist, and I've been a consultant since 2003. And I started my career more as a general gynaecologist looking at fibroids and heavy periods with keyhole surgery. And slowly that morphed into a urogynaecologist where I deal with incontinence and prolapse and pelvic floor reconstruction. And of course, that then morphed a little bit more into menopausal symptoms, because a lot of the symptoms I deal with are in the perimenopause and the menopausal woman. And through Stefano Salvatore, who's a colleague of mine that I worked with as a junior doctor, who was a consultant in Milan, who developed the MonaLisa, I've morphed into doing a little bit of that as well. Thank you. Next slide, Vicky. So there've been a lot of questions that we've tried to amalgamate into this talk, and obviously if there are extra questions, please feel free, as Vicky said, to ask those at the end. But really we want to go through who is the MonaLisa Touch for and what it's used to treat. We'll talk about the MonaLisa Touch treatment itself, because some people are quite nervous about what it actually entails, what to expect from the treatment and what symptoms we hope to improve, the risks and the recovery, and then we'll talk, as you'd expect, about our gynae service at Benenden Hospital and what we can offer from the 4 consultants that work at Benenden, and then the question and answer session at the end, which Vicky will host. And thank you for some of the questions that we've already had in. Next one, please, Vicky. So what we started off, we'll start off with just talking about who the MonaLisa is for. And essentially, it's a low power laser treatment in the vagina. It works by thickening up the skin inside the vagina. So therefore, it's very good for vaginal dryness for whatever reason, and vaginal discomfort. And a lot of ladies will have discomfort as they get older, as the skin thins in the perimenopause and the menopause. I'll talk about what it's not used for later on. This is one of those conditions, a little bit like, I suppose, male impotence, where it's a very unspoken disease. Men don't talk about impotence, and women of old wouldn't be speaking about the soreness in the vagina and inability to have intercourse, etc. We tend to see women who are in that perimenopause and early menopausal stage, which is about 45 to 60. And certainly when we first were looking at it and first developing it in Milan, we assumed it would be much more of the 70 and 80-year-old women, but we're seeing much more the younger women. It's very much also, we use it in younger women, or any women, I suppose, but younger women who are having breast cancer treatments. Some of the breast cancers, as you know, are estrogen positive, and therefore people are very nervous about having estrogen treatments. And the estrogen treatment can help with thin skin in the vagina. But women who've had breast cancer treatment or who are undergoing breast cancer treatment are very reluctant, understandably, to use it. And lots of the drugs that are also used to treat breast cancer are very anti-estrogen type tablets. And this has a really bad effect sometimes on the soreness and the thickness of the skin in the vagina. And the MonaLisa, because it's not hormonal, can really benefit those younger women who are on breast cancer treatment. Yes, thank you. So it's used for vaginal dryness, the sort of itchiness that you can get with that. It's a burning pain quite often. Some women will, when you go through the menopause, you lose a lot of the fat in the vagina, and therefore the vagina can feel quite lax, almost like a prolapse. We do use it for mild bladder weakness, and by that I mean people who perhaps would leak urine or have an urgency, an urge incontinence. And obviously, as we've talked about, pain during intercourse and the general the thinness of the skin in the vagina. It has been used and is used for lichen sclerosis. And lichen sclerosis is a skin condition which we think is quite often because of an autoimmune condition. But again, it's because of thinness in the skin around the vagina. We don't sell it as a treatment of lichen sclerosis at Benenden, and we also don't sell it as a urinary incontinence treatment. But almost every woman that we've seen with lichen sclerosis and urge incontinence and stress incontinence has got better. So really we're using it for laser vaginal rejuvenation. I've put in this term genitourinary symptom of the menopause, and this was bandied around about 5 or 10 years ago, but I don't like this term because it implies that only women in the menopause will have this issue. And as we've said already, this does affect women who are younger and in their 30s and 40s sometimes. Thank you, Vicky. So the way it was developed was that Stefano Salvatore, who's a gynaecologist, was literally seeing a young woman who'd had very bad scarring after giving birth, and nothing that he could do seemed to make that scarring better. And in the Milan hospital where he was working, one of the dermatologists, that's a skin doctor, was using a very low power laser to treat burn victims with burns on their faces. And he suggested that he tried it on this one woman who'd got scarring from childbirth. And the results were quite startling and quite marked, that it softened that scarring. And so he started a process of research from 2012, looking at women with scarring in the vagina, thinness of the vagina, and atrophy. And through him, we brought it to Benenden, the MonaLisa Touch, and we've been using it at Benenden since 2017. It's not the same as laser treatment in the vagina, where people are using that to tighten the vagina or to cause scarring, if that's the right word, to tighten the bladder up if you've got stress incontinence where you leak when you cough. And this is not a laser for doing that. This is merely a laser to thicken the skin in the vagina, and it uses a very low power laser compared to these other lasers, which are much more high power. May I have the next slide, please, Vicky? So in the research, this was looking at the first 2,000 women, but the numbers are very similar for the next 10,000 that we treated in, or Stefano's treated in Milan. But this is looking at the symptom improvement in women having MonaLisa. And of course, they're coming in with burning and itchiness in the vagina and dryness in the vagina and pain with intercourse. And what we found is that there's a very, very good response with between 70 and 90% improvement in all of these symptoms. And as I said, that feeling of laxity is almost like a prolapse in the vagina is also improved. And this is not necessarily because of the tightening factor that everybody thinks of, but it's the fact that you're plumping up the tissues in the vagina, and therefore it doesn't feel as lax inside. The way that the hormones work, if you're using hormones in the vagina, is that it thickens the skin in the vagina, but also increases the amount of fat in the vagina. And we think that the laser works in a very similar way in the vagina with that laxity. But the obvious things of pain with intercourse, the dryness, the itching and burning, all improve. And what I say to ladies that come to see me is that everybody will improve. It's just that some improve more than others, and that's certainly shown through in our research. Thank you, Vicky. So how does it work? Well, I think we can now say it's a proven procedure, although we used to say that the data was very limited, but more than 10,000 women have been treated between us and in Milan, and we're training more and more people in the UK and abroad in this treatment. So, which is great news. The problem, of course, is it's still only a private procedure, which is a shame, but it has been proven, and I think it's a good adjuvant to other treatments. I said it was a low-powered CO2 laser, and just to give an idea of the power of it, if you've got a 20-watt light bulb, you can hold that light bulb in your hand, and the CO2 laser that we use is about 20 to 24 watts, so it's of that sort of power. And what it does is it stimulates the collagen and the fibrocytes in the skin to grow more quickly and to thicken up the skin. It changes the menopausal or older collagen into a younger type collagen. And then the complicated things are the glycosaminoglycans and high hyaluronic acid production. I've left that in because if you think about it, a lot of skin products now have got collagen in it, and a lot of them have high hyaluronic acid in it as well. And what that does is it makes the collagen and the skin feel younger. And that's exactly what the MonaLisa is doing by stimulating the fibrocytes, which are a type of skin cell, into making this younger type collagen and younger type glycosaminoglycans. Thank you, Vicky. So if you come to the hospital or any of the units around the country, but obviously we want you to come to Benenden, it's very much an outpatient setting. It's a private environment where there's just, most of the time I should say, it's only the laser that's being used in that clinic. The whole thing takes about 5 minutes to perform. Importantly, you have 3 sessions, which are about 6 weeks apart. The data shows we did lots of different sessions, whether it was 2 or 3 or 4. We tried 4 weeks apart, 2 weeks apart, 6 weeks apart, 8 weeks apart, 10 weeks apart. But on average, most women, the vast majority of women, the best results are having 3 sessions, each of them about 6 weeks apart. Sometimes you'll have, assuming everybody improves, sometimes you'll have a little bit of improvement after each session. Sometimes you'll have a lot of improvement after the first session and much less after the second and third, but it's still important you have that second and third treatment. And sometimes there'll be very little after the first and second, and then more improvement after the third. It's very variable. We have a top-up session, and certainly in Milan when we started, because it's funded very much by the Vatican and therefore much, much cheaper, we were finding that women wanted to come back a lot earlier. So we essentially have a cut-off in Milan where they can only come back at a year. The Italians don't tend to use, or didn't tend to use, very much in the way of hormones and HRT. At Benenden, I started off with hormones in the vagina, so that's called Vagifem or Vagirux, or the cream. And we found that if you use that, if you're able to use the hormones in the vagina, if we use that at the same time as the laser treatment and you persist in using it, we find that rather than coming back at a year, most women are coming back at 18 months or sometimes even longer. And in Milan now, they're giving the Vagifem or the Vagirux as part of that treatment, and they're finding exactly the same effect that annualized top-up session, which is one session, not three, but that one session, they're now coming back at 18 months sometimes or longer with the use of the hormones. But obviously not all women can use the hormones. Thank you, Vicky. I've put a little photo of what the device is, and that's just sitting in the vagina. And that thing on the right, the lumpy thing on the right, is the womb, and it's next to the cervix. And just above it is the bladder, and the ring is on the outside of the vagina. And it shows how close the bladder is to the vagina. So obviously, if you're getting soreness and thinness in the skin of the vagina, because you're losing the hormones, you're also getting thinning of the bladder. And this is why most of the women who have bladder problems, when they have the MonaLisa Touch treatments, will also help to thicken up the bladder, and their bladder symptoms will also improve. The device itself, or the probe, is about the same size as your middle finger or thumb. So, of course, a lot of women are having this because of soreness in the vagina and an inability to have intercourse. So we can't have a big device. It's not like having a smear done. It's literally like having a thumb or a finger put in the vagina. So it is relatively comfortable. What I now do is we treat the inside of the vagina, which is relatively, isn't very uncomfortable with the laser, but I also treat the outside as well, because if you have thinning in the vagina, you'll very often have thinning of the skin of the outside of the vagina as well. We treat that with a slightly different probe, or different laser, but a different probe, and that can be quite uncomfortable. So when you come for the treatment, you come 10 to 20 minutes before the treatment starts, and we give you a local anaesthetic cream to put on the outside skin. And that just numbs it to take the edge off. But the laser inside the vagina is very insensitive to the laser. Thank you, Vicky. And what you do is it fires off little light beams. And essentially what you do is you put the probe in, you fire it, you twist it 45 degrees, and you get this sort of pattern of heat treatment inside the vagina. And the whole process, as I said, takes about 5 minutes. And the aim is to try to stimulate through heat treatment, not by burning, but by heat treatment, the fibrocytes that we talked about before. And on the outside, with the laser that we use for that, or the hand device we use for that, you get a little pocket of about 16 of these little heat treatments, which you can sometimes see for a couple of minutes as little white dots on the skin, but they go away very, very quickly. Thank you, Vicky. We were asked about, or I should say about the side effects, and there are very few because this is a very low power laser. But we have had some ladies that had some bleeding after the first, or sometimes even after the second treatment. This isn't really an issue with the laser itself, but more that we're treating very, very thin skin. It does cause a little bit of inflammation, and therefore, if you have inflammation and then you're walking afterwards, you can rub that skin and you get some bleeding because of that. And if it causes a discomfort or inflammation, you can sometimes have a discharge, which is a mixture of protein and sugar. So it's not usually a smelly, infectious type discharge, but just a discharge almost to protect the skin. And it can be a little bit tender. And certainly, if you get that tenderness, it doesn't really last very long, but you've got the tube of local anaesthetic cream that you can use if you need to. And of course, by causing the inflammation, and if you're walking and when your normal activities, you can also feel a little bit swollen afterwards. And because it's treating the vagina next to the bladder, very occasionally you can get a feeling of cystitis or bladder pain, especially when you pass urine, because of course, if we go back 2 slides, please, Vicky, sorry, to the one with the probe in, that one there. Of course, just above that metal probe, that's the bladder and the wee tube, or the urethra. And because you're treating the outside, it can sometimes cause a little bit of irritation to the opening of the wee tube, so that when you pass urine, it can sometimes sting a little bit. But again, very, very few people have any problems. If we go back to, again, please, Vicky. Thank you. And of course, the biggest issue is because this is something that nobody's had before, it's that worry about the treatment. And usually people say, gosh, that was very easy. And then the second and third time, they know exactly what to expect, and it makes it much more easy. Next slide, please. After the MonaLisa, this is a bit more important because you are getting that soreness or irritation in the vagina, of a vagina that's already a little bit irritated. So we don't recommend that you exercise, especially running or swimming, for a few days afterwards. And of course, the reason for that is that when you run, you're potentially rubbing the vagina inside, and that's the same with swimming. And of course, most of the time when you swim, you do the breaststroke. So you're opening the legs up. And if the vagina's sore, that can just pull on it and make it more sore. And cycling, obviously, will be treating the inside and outside of the vagina. So sitting on a bicycle seat, which aren't the most comfortable things in the world, is probably not recommended either. Having intercourse afterwards, again, because you're irritating the vagina inside, we don't recommend that for a few days. And driving as well is absolutely fine because you're not causing any problems. It won't cause any problems. But the first time you come for the treatment, most people come with a friend just in case they feel sore afterwards. Thank you, Vicky. So what we'll do now is we'll answer some questions if people have any questions. And I'd just like to talk very briefly about Benenden itself. There are 4 gynaecologists that work as a team, so we're all general gynaecologists. We've got experts in the menopause, so that's myself and one of the lady doctors, Anna. We've got 2 specialists in, I'm sorry that my camera's going up and down, 2 specialists in urogynae, so that's prolapse and incontinence, and we offer many services for that. We've got a fantastic team of specialist urogynae nurses that can teach you about bladder drill, pelvic floor exercises, there's Jan, pelvic floor exercises, and bladder health in general. And they also do some of the tests that we may have to do on the bladder before or after surgery. And part of that incontinence treatment is Bulkamid, which is like a bulking agent around the wee tube, Botox for an overactive bladder. And obviously, we've also got other outpatient treatments for abnormal bleeding, including hysteroscopies, where we look inside the womb. And we also have other services like cystoscopies, where we can look inside the bladder. If you go back again, please, Vicky. Thank you. And 3 of us also deal with endometriosis and pelvic pain, which is one of those disease processes that is often overlooked. And we treat everything else from ovarian cysts and minor minimal access treatments of hysterectomies and vaginal hysterectomies as well. So it's a full service, a little bit like an ordinary NHS hospital with experts, but we all do a little bit of everything. So I hope I've kept the time. That gives us a little bit of time to answer any questions if people have it. So I'll leave the floor to Vicky now. Thank you very much.
Well, thanks, Mr. Connell, for that presentation. I'm going to take some questions. So the first one is, after treatment, do you have any advice on products or supplements to prevent symptoms returning, or is this inevitable? And how soon after could symptoms return?
A very good question. So I'm very pro the estrogen HRT, but as I said, some women either don't want to use it or can't use it. The advantage of that is it maintains, if you've got a good response from the MonaLisa, it helps to maintain that thickness so that you don't have a withdrawal of that thickening so quickly. The women who don't or can't use the HRT or the Vagifem in the vagina, as I said, it does wear off. But again, like the success rates of it, it's very variable. So we have some women that don't come back for 18 months, some that come back at 8 or 9 months because they felt that the symptoms are deteriorating again, or the symptoms are worsening. So it's very much an individual response. Products-wise, I'm quite old-fashioned, and when I was a junior doctor, we used to use an awful lot of olive oil as a treatment in the vagina to keep the skin healthy. What we've moved over to in the last 5 or 10 years is coconut oil for cooking. And you use the coconut oil for cooking as a soap around the vagina and inside the vagina. It's a very good moisturizer, because you never think about moisturizing the vagina. It's very good as a lubricant, so when you're walking, it's not rubbing it, or when you're having intercourse, it's very good from that point of view. And also it's mildly antiseptic. So as you get older, the good bacteria in your vagina deteriorate or diminish, which allows you to have more likelihood of having infections, whether that's infection in the vagina or infection in the bladder. And so we promote that an awful lot. So that's coconut oil for cooking, putting it in the vagina as often as you can. I'm not hugely impressed with other lubricant products, mostly because they're either made from mineral oils or they're made from water-based products or even petroleum like Vaseline. Whereas the coconut oil for cooking is a natural product and it's got nothing added in it. And I have had some women who've been a little bit allergic to Yes or KY jelly or whatever. And a lot of these water-based lubricants, if you just put it in your hand and rub them together, very quickly, within a couple of minutes, it'll get quite hard and sticky and tacky. Whereas the oil-based products are a lot more, they're just a lot happier and they keep the skin much healthier.
Okay, thank you. That was helpful. We've sort of covered the next one, but it might be worth reiterating. But how soon could I return to cycling, yoga, or a spin class, please?
So you're talking to a man that doesn't exercise very much, but cycling we wouldn't recommend, because that is it's not the forcing, it's just the seat and where it is, and it's very sore anyway. A lot of my friends that cycle a lot, who are men, will use Vaseline and products like that around their seat area because it's very uncomfortable, and a lot of the women that I know will use that as well. So I just would not do anything for a week or two afterwards, just to let it settle down, especially after the first treatment. But of course, the aim of doing this treatment is, if you're exercising, it's very uncomfortable, it's to allow you to do the things you want to do without it being uncomfortable. But I'd argue probably a week or two for most exercises.
Okay, thank you. Next question. I have very sensitive skin. Is this a higher risk for laser treatment?
It's not a high risk for the laser treatment, and obviously the question is, why is the skin sensitive? So if you have sensitive skin, whether that's like eczema or just generally sensitive skin, and then you have a bit of a discharge in the vagina sometimes because of that sensitivity, a lot of women will then use products in the vagina to keep the vagina clean and use water. And of course, water is very drying, and that makes the skin even more sore. So what I'd recommend is, if you're sensitive, if you think you've got sensitive skin or it is very sensitive, not to wash the vagina out with water or soap products. Use the coconut oil as a first line, because it's very soothing. And certainly after the treatment, to use that again, because it's very soothing. But of course, we're using the MonaLisa laser treatment for women with sensitive, sore skin. So I'd argue that's one of the reasons that I would treat the vagina if the skin is very sensitive.
Okay, lovely. Hope that makes sense. Next question. I'm 47 and have been using Vagifem for a year, but NHS guidance says it can only be used for 2 to 5 years. I won't be using any other HRT. So should MonaLisa Touch be used before the end of the use of Vagifem to get the most benefit from it? Okay,
so as I said before, I'm very pro HRT, and a lot of the stuff that's written about HRT is, everybody has slightly different opinions on it. My argument about Vagifem is that Vagifem is a very, very low dose of estrogen. So compared to an estrogen tablet for HRT, it's about 1,000th of a dose. So that means you could use it every day for 3 years, and that would be the same dose as one HRT tablet. So universally, we know it's a very, very safe drug to use in the vagina. I suppose the principle behind you must only use it for ... is so that you see your GP. It's just not on continuously being prescribed. And like all medicines, whether they're blood pressure tablets or whatever, you ought to see a professional regularly to make sure it's the right treatment. I say in the old days, but we're talking 10, 15 years ago, there were two dose regimens of Vagifem. One was 25 micrograms and the other was 10. And the 25 micrograms was designed for the older woman who couldn't put the Vagifem in her vagina herself. And the district nurse would come round to either her house or the nursing home to put the vaginal estrogen in her, this little tablet, to put the tablet into the vagina twice a week. So that lady was getting 50 micrograms a week. The 10 micrograms were used every day by women who are more dexterous. So that woman was getting 70 micrograms every week. What we've now done is they've stopped making the 25, so you only have 10. And a lot of the GPs and pharmacists will say you must only use it twice a week. So those women now are only getting 20 micrograms a week rather than 50 from the more infirm women or the 70 from the more dexterous women. So again, that to me seems a bit of a nonsense, and common sense says it's not the right thing to do. The one thing I would say about Vagifem is that a lot of the times people will prescribe it every night for 2 weeks and then twice a week after that. And I don't do that. I use it twice a week to start with because you can get a bit of a reaction to using it so often straight away. So I tend to say twice a week for 2 weeks, 3 or 4 or 5 times a week for the next 2 weeks, and then every night after that. And you can use it long term. So I'd argue to use it forever and ever, but just check with your GP that he's happy to carry on with that. Bearing in mind that HRT, which is 2 to 1,000 times higher dose of estrogen, I've got women in their 80s and 90s on it. So you can use that, a much higher dose for longer. So I would argue that 3 to 5 years is not ideal, but you must see somebody. Because if you're using it for a sore vagina and it's not helping, then you need to check to make sure there's nothing else going on that can be treated, like lichen sclerosis or other things. I think in a very roundabout way, I've probably answered that, Vicky, have I?
I think so, yes, very comprehensive, thank you. Next question. I have recently had surgery to remove fibroids. Should I wait before having MonaLisa Touch? And if so, how long?
So there's 2 ways of having the fibroids removed. One is through a cut in the tummy or keyhole to take them out that way, and the other is through the vagina using a hysteroscope to cut them away. So for both of those, the answer is probably the same, in that the Vagifem makes no difference and the MonaLisa makes no difference. The only thing I would say is that if you're bleeding still, then you mustn't have the laser treatment, because blood shields the inside of the vagina and almost acts like a mirror. So whenever we see women who are bleeding, we need to clean the vagina out very gently. So no, I'd wait until you were recovered. It should have no effect on, sorry, I'll rephrase that. It has no effect on fibroid treatments. It has no effect on anything else. In theory, although we would never do it, because it's so safe, you could use it even during pregnancy. Of course, we wouldn't do that, but it's very, very safe. So I would just say, get over the operation till you feel happy, and then have the treatment if you want to.
Thank you. Next question is from Diane, and she asks, I have an HRT implant because I don't have ovaries or a uterus. Would this treatment be suitable for me as I'm plagued with UTIs? Okay,
so the implant is usually a little pellet of estrogen that goes underneath the skin. So it just gives you a continuous amount of estrogen, a little bit like the patches. So it's through the skin, slightly different to the gel and the spray, but the same sort of treatment. What was the second bit of the question? Sorry, I was on a roll then.
It would be suitable for me as I'm plagued with UTIs.
Yeah, UTIs, that was right. So, so what I would do first of all, rather than leaping into the MonaLisa, would be to think about having the hormones in the vagina. Because again, for the same reason I said before, that the Vagifem and the MonaLisa will thicken up the skin in the vagina. it'll thicken up the fat in the vagina, and it'll help to close and protect the wee tube, because obviously the wee tube as you get older shortens and opens slightly because you're losing the fat in the vagina. What I would say for that woman, to Diane, is that, again, very much I would use the coconut oil for cooking, because the coconut oil for cooking is mildly antiseptic. And for the women with recurrent infections, as long as you've had the bladder checked to make sure there's no stones or anything else in the bladder, what I recommend for that is that before and after you go to pass urine, you put a little bit of coconut oil into the vagina around your wee tube, because when women stop peeing, they suck up a little bit at the end. So what you're then doing is you're sucking up a little bit of the antiseptic coconut oil for cooking, and that reduces the risk of infections and UTIs. So that's the first thing I would do. But of course, the Vagifem, the hormones in the vagina, and the MonaLisa Touch help with urinary tract infections, because it thickens the skin in the bladder, thickens the skin in the vagina, and thickens the skin around the wee tube. So definitely, but you need the extra rather than just the HRT, because the HRT you're getting as a tablet, a patch, an implant, a spray, whatever, is never enough to get into the vagina to help with the vaginal problems. So they're two separate things.
Okay, lovely, that makes sense. So Delvina has asked something similar about chronic UTIs. I think we've answered that, but she's also asked, how long does the treatment last?
So there's two bits to that question. So I guess the treatment itself, when you come in, lasts about 5 minutes for each session. How long it lasts before you need a top up is very much dependent on the person. So as I said, most women have an improvement. All women have an improvement, but as I say, it may be that much, or it could be this much. And again, how long it lasts is again dependent on the woman herself. Since 2017, I've only had about 5 or 6 women who've come earlier than 10 months. We've had quite a lot that have come between 10 and 12 months, but the majority is over 12 months coming back for their top up. Of course, the women where it hasn't worked at all, or not worked as well as they wanted it to, presumably haven't come back at all.
I hope that's helped, Delvina. Next question, are there many alternatives to MonaLisa Touch, and how do they compare with symptom improvement?
This is where we get into lasers in the vagina, and as I said, this is fraught with a little bit of controversy, because the MonaLisa Touch is a CO2 laser, and the way it works is it essentially causes the heat because it goes onto red blood cells, so blood in the skin. And as it's so low powered, that's how it heats it up. But there are lots of other lasers out there, but they're much higher power, and they work on, for example, the bladder incontinence by causing scarring and burning. I suppose the easiest way to think about that is that when you have an uncooked egg, if you heat it up, it turns white because you're denaturing the proteins, and the high power lasers work by doing that. There are a couple of other lasers around which again are very low power. I don't know very much about those, but certainly if the data's there, there's no particular reason why you can't have that done. But we looked at several in 2012, 13, 14, and again we looked at them again for Benenden in 2016, and we just thought the MonaLisa data was far better. So I would encourage people to think about MonaLisa more rather than the other treatments. And of course, other people have done a similar thing, which is why there are more centres for MonaLisa than there are for Juliet and the other lasers, because the data's there.
Okay, lovely. Thank you very much. Next question. This attendee says, I'm 67, post-surgical menopause after hysterectomy 23 years ago. Would I be suitable for treatment? Yes.
If the trouble with the surgical menopause is, even if you have a hysterectomy and they don't take the ovaries tend to only last about, on average, and again, it's very difficult to prove this, about 5 years. So if you're having a hysterectomy in your early 40s, you're likely to go into a proper menopause mid-40s. The average age to go through the menopause naturally is about 52. So that lady will then be having 5 or 10 years more menopause than a contemporary of hers. But of course, the average age means that some women go into the menopause naturally at 42 and some go in it naturally at 62. It's all about symptoms, it's not about age. So whether you're 35 with breast cancer treatment, 45 with the perimenopause, or 75 with thinning of the skin, it doesn't matter. It's not about the age, it's about the symptoms.
Lovely. And kind of carrying on from that, somebody's asked, who would MonaLisa Touch not be suitable for?
I guess the answer is almost nobody. I think it can be suitable for everybody. Sometimes if you've got a lot of scarring in the vagina, and we have had some ladies who've had lots of surgical treatments for prolapse, for example, where there's a lot of scarring, and we sometimes use the MonaLisa to try to soften that if the hormones don't work. Women who've had radiotherapy in the vagina, for example, for cervical cancer, the responses to that are much less good than the young women who are on breast cancer treatment. But again, I would use it for those ladies as well, because if it's that sore, anything is going to help. So I would say almost nobody is excluded. There's no contraindication to anybody. We don't use it in pregnancy because there's no data. And obviously women who are pregnant have lots of hormones going around, therefore the vagina isn't sore. So I didn't mean that in a flippant way, but it is very, very safe. But we wouldn't use it for pregnancy. But that's probably the only way we wouldn't do it.
Okay, lovely. Have a couple more questions. So Deborah asks, what about if you have Nabothian cysts within the lining of the vagina? Is this treatment still okay?
So if it's a Nabothian cyst, the Nabothian cyst is a little inclusion cyst on the cervix, and of course it's absolutely fine for that. You can get lots of little cysts in the vagina itself because the vagina is full of little glands that produce various products, whether that's thick mucus or thin mucus, to keep the vagina healthy. So having lots of little cysts in the vagina is not an exclusion for the MonaLisa. And the Nabothian cyst on the cervix, certainly it doesn't affect those in the slightest.
Okay, that's great to hear. I hope that's helpful, Deborah. And last question we've got is from Delvina again. She asks, after the 3 top-ups, are you ever cured?
I never use the term cure for anything. All we do is we make symptoms better. So the answer is you have the vaginal atrophy for a reason. So usually that's because of the hormones going down, or the hormones being non-existent in the menopause. So of course, when you thicken it up and make it better, unless you're getting more hormones to keep it thick, it'll just start thinning out over time. And as I said, it varies between people of how quickly that happens. So no, you're never cured. It doesn't reverse it. Sorry, it doesn't cure it. It just reverses it to some extent. And slowly with time, it reverts back to pre-treatment. And that's why you have the top-up. I would just encourage that if it does work for you, is not to wait until it gets really, really bad again. Because if you wait, I don't know, 2 or 3 years till it's really bad again, we tend to do the 3 treatments again. So the ideal is when the soreness, although it's very, very difficult to measure, when the soreness is sort of between 50 and 75% of how good it was, have the top up then to just give it a little boost up. But no, you never cure. It only makes the symptoms better.
Lovely. Thank you for that. I think we've covered all of the questions. So we've just included a slide here. I don't know if you wanted to say something about this slide, Mr. Connell.
Oh yes, this was from before. So this was just understanding the risks of breast cancer, because some women were very concerned about the use of vaginal estrogen. And bearing in mind that we talked about the fact that it's about 1,000th of the dose of systemic HRT. So essentially, it's just a pictorial example of risks of breast cancer based on various things. So The normal population, as I said, we're calling it 23. So it's about 1 in 20 women will develop breast cancer. If you have the combined HRT, so that's estrogen and progesterone tablets, you have 4 extra cases. If you're on estrogen alone HRT, you have 4 fewer cases of HRT. And you have to have progesterone if you've got a womb, because you need to protect the lining of the womb with the progesterone. So a woman who's had a hysterectomy, who goes on estrogen alone HRT, will have less chance of developing it. And that's similar with the combined oral contraceptive pill, because of course that's estrogen and progesterone tablets. The next one is about if you're having more than 2 units of alcohol per day, because alcohol does increase the risk of all cancers, and it does increase the risk of breast cancer as well. Smoking, of course, causes cancer everywhere, so there's another 3 additional cases if you're a smoker. And the biggest risk is BMI over 30, and we know that being overweight causes risks for everybody. So the woman who exercises, and that, as it says at least 2.5 hours of moderate exercise every week, who has a normal BMI, so normal weight, who is on estrogen alone HRT, then that significantly lowers the risk of breast cancer. But the woman who smokes, drinks excessively, is on the pill or on the bad form of HRT, which is the estrogen progesterone tablets, and who's overweight, has a significant increased risk. But of course, this is based on estrogen and progesterone tablets, and the data for the gel and the spray, because it's a much, much lower dose, isn't there yet. But just to give an idea, because a couple of ladies wanted to know about it. And with the Vagifem, which again is the very, very low dose estrogen in the vagina, that is estrogen on its own. So of course, the third one down, which is 4 fewer cases in women on estrogen alone HRT, Vagifem is estrogen alone HRT. So even if it did have an effect, it would be lowering your risk of breast cancer in that woman. So hopefully that's made some sense.
Great, lovely. Thank you very much for explaining that. So that's all we've got time for tonight. So as a thank you for joining this session, we're offering 50% off the value of your initial MonaLisa Touch consultation. This is available for 7 days. A call back from your dedicated private patient advisor, an email with a recording, treatment information and loyalty scheme reward points, and updates on news and future events as well. And we'd be grateful if you could complete the survey at the end of this session, and this helps us to shape future events. If you'd like to discuss or book your consultation, our private patient team can take your call until 8 p.m. this evening, or between 8 a.m. and 6 p.m. Monday to Friday, and that's using the number on the screen. So we've got more events and webinars coming up in the new year on orthopaedics and urology, and you can sign up to any of these on our website. So on behalf of Mr Connell and our expert teams here at Benenden Hospital, I'd like to say thank you for joining us today, and we hope to hear from you very soon. Thank you and goodbye.
Thanks, everybody. Thanks, Vicky.